This program is brought to you by First National Bank of Botswana.
FNB, how can we help you?
The world is in mourning because of a grave viral outbreak that we have now come to know as COVID-19. Scores of people have died and multitudes more still hoping to recover from this virus. Stock markets have plummeted while countries have imposed countrywide quarantines and stopped all travel, all in efforts to curb the possible spread of the virus. At the time of recording this episode, our neighboring country, South Africa, had undergone lockdown at midnight Friday the 27th. All of this to contain the virus, which was now spreading in an uncontrollable manner. In response, our country closed all her borders, only allowing in Botswana from affected countries together with personnel from essential services. Local hotel facilities have been occupied with these individuals from these places. The concern is they may have been exposed to the virus on their travels. As a precautionary measure, they undergo a mandatory 14-day quarantine period, isolated from everybody else, including their families. Bars have been closed, entertainment spots are now regulated, with restaurants now operating as takeaway spots instead of sit-ins. When first issues was recording this episode, fears were mounting of a possible lockdown. All of these have been reported on, but it is our humble opinion that all bases about the virus have to be covered, especially why it is essential for people to be isolated while the war on the virus ensues. Our guest is Dr. Kiran Bhagat, who tells us what this virus is and what happens to it during its lifespan and all other pertinent issues regarding the microorganism.
This is a virus that has occurred unexpectedly. We have never seen this virus before. It is, from an epidemiological perspective, a long word, which basically means observation of disease patterns. This is something that occurs every 100 years. Where a new virus emerges where the body has not seen it before. So there's no, what we call in medicine, innate immunity. You know, we give influenza vaccines on a yearly basis because the influenza virus changes, but its basic core structure doesn't really change. So we're able to modify the vaccine. So influenza vaccine protects you against influenza. The same with pneumonia vaccines. The problem with this virus is that we've never seen it before, and so we don't know how to treat it. We've never seen the structure. We've never seen how it infects people. So the world has been playing catch-up over the last 2-3 months as it broke out in the Wuhan province in China. So its origins are debatable, but what has happened is it has infected us on a rapid scale because we have nothing to fight against it. You know, your body has an artillery, if you like. It has soldiers, it has tanks, it has jet fighters in its system, and it rolls out that BDF in its system depending on what's attacking it. And now the problem is it's come in what we call in the army subterfuge, where it's come in under the table, nobody knows what it is, and before you know it, it's killed thousands of people. And we know with the rapidity, the rapidness with which it's affecting people, that it is escalating in what we call in mathematics a logarithmic scale. So for example, the United States at the beginning of March had only 72, 73 cases. Within 2 weeks it had escalated to 225 and then now to 7,000 to 8,000. That's estimated to be a 54 to 55 scale multiplier.
Perhaps at this point we would want to understand for how long it survives and how it is transmitted from one person to the other. How does it move?
The most positive thing about the virus, if there is such a thing, is that it's very easy to kill it. It survives on, for example, a piece of paper for up to 72 hours. So generally between 2 and 3 days it's still active. People have tested on wood and on steel and on paper. So generally 2 or 3 days it's still alive. So it's the reason why the most important measure to prevent and contain the virus is hygiene. The symptoms, for example, are a dry cough, a severe headache, it's fever, and then the virus tends to get into the system. In the first place, it generally attacks the lungs, and it causes what's called the release of heat shock proteins and cytokines. These are inflammatory chemicals in the lungs which flood the lungs with liquid and you suffocate. So the transmission is generally by droplet infection. So it's by cough, it's by moisture, it's by breathing somebody else's virus into your system. It's by touch, because people touch their faces, they touch their nose, they blow their nose, they don't wash their hands. So it's easily transmitted through touch. It's easily transmitted if you're not coughing and covering your cough. So those are the first measures. If somebody is coughing, stay away from them. If somebody has a sneeze or a flu, and we're unfortunately going into the winter season, and winter looks like it's coming early. We've had rains, it's getting colder, so people are more likely to get the normal winter coughs and colds. So for precaution, make sure that you stay away generally. Social distancing, we're going to talk about it in a minute, to avoid droplet infection. Always wash your hands, and you've got to wash your hands with something that will kill the virus. And the thing that has been shown most effectively is high percentage strength alcohol. So between 60 to 70% alcohol strength will destroy the virus, provided you use it appropriately. If you have been into an area that potentially is at high risk, when you get home, you take those clothes off, you put them in the wash, or you physically wash them, and you get into the shower to try and wash yourself off from any potential infection. So these are simple measures, but they are the most effective measures, which is the reason why worldwide we are seeing this race, if you like, to close down, shut down, lock down, whatever word you want to use, public movement, to ensure that there's no spread, because that's the easiest way to containerize this and to allow those members who are positive to develop an immunity.
Where are we as far as at least a vaccine, and maybe we could talk about a cure? Is there any light at the end of this dark tunnel?
Well, I think the most important thing was announced a few days ago by the United Nations Secretary General. And I think the thing is that everybody has come together as a global community. And it's important to recognize that we need data, we need information, we need testing. The second thing is that globally there has been a race to develop not only a vaccine but also a treatment for those that are infected. And there are some very important drugs that are currently in trial and on a fast-track trial, which have shown effectiveness. And there are a number of drugs, antiviral as well as antibacterial drugs, that are in study at the moment, and I'm sure within a very short space of time we'll be able to have some sort of guideline as to what to use, when to use, how long to use, and what side effects to expect. In terms of a vaccine, it's unfortunately at least 12 to 18 months away. Not so much because the vaccine has not been developed, and the vaccine is currently in trial in the UK as well as in North America and in Europe. There are already trials that have been started on a vaccine that potentially will be effective, but we need to observe the duration of that vaccine to see how effective it is, how long it's effective for, what are the side effects, who should we give it to, how often should we give it. So it's anything between 12 to 18 months away in terms of that. But the vaccine is the best way to ensure we stem this coronavirus. Besides social distancing, besides hygiene and making sure that you are mindful of washing your hands, is to make sure that your body is in a state of readiness, that you are boosting your own immune system. You've got to exercise. You've got to circulate your blood in the system. You've got to make sure that you're eating the right foods that contain immune boosting potential. We talk about, foods high in vitamin C, high in vitamin K. These are all your dark green leafy vegetables, spinach, morojo, okra or delele. These are foods that we know are very healthy and are immune boosting. We're talking about nuts, we're talking about legumes, we're talking about seeds, we're talking about a lot of protein in your system, we're talking about eggs and fish. We're talking about avoiding things that depress your immune system, things like sugar. Sugary foods. We've talked about them before, your fizzy drinks, your fruit juices, your sweets, your chocolates, your ice creams, your breads, your pastas, all these processed foods drop the immune system. So, the things, and for those that can't take those, supplementation, high doses of vitamin C will help because they boost your immune system.
I want us to talk about why it's important for people to stay home, why it is that you're encouraged. If it's not necessary, stay indoors with whomever it is. Stop visiting, stop going out, all of that.
I think the public have not quite absorbed and digested the fact that the virus is transmitted by moisture, by conversation, by close contact with people. And better than sanitizer is to socially isolate yourself so that you are within an environment which is contained. which is quarantined, if you like, which only you have access to. And it's difficult, in this day and age where we are asking people to stay at home. I know it's understandably difficult. It's depressing. It's socially isolating. We are social humans, particularly the elderly. We know the elderly are at risk because they are already socially isolated, but they are unfortunately also the most at risk. And so the best way to prevent the virus from infecting these elderly or others bringing it to them is unfortunately to say to those who are at risk, and those that are listening to this program know who they are, to stay at home. I saw the other day that now the restaurants and the bars and the clubs are closed. People are outdoor having a picnic. This is not the way to isolate. We need to take this seriously because you may not be putting yourself in danger, but you're putting others in danger. So this has to be a social project. It should transcend the individual. This has societal impact. You, me, your grandmother, your grandfather, your parents, and so be responsible in terms of social distancing when you do have to go out into public, as well as going to the supermarket. But at the same time, try and stay at home as much as you can. The virus has a peak, and it will peak. We have yet to see the peak. It's begun in South Africa. It's yet to begin in Botswana. So we don't know where we are on that peak of this pandemic. So we've got to wait and see what happens to our public. And the best way to see that is to keep people where they are in a containerized environment so we can observe how this epidemic or pandemic unfolds.
When running a business means
Where did I put that receipt?
we can help you with instant accounting, free software that does your bookkeeping for you. When running a business means
Wait, what do you mean the container hasn't arrived?
we help protect your business from risk with Mohwebi Insurance. And when it means
How do we pay our staff that don't have bank accounts?
we help you make multiple payments directly to people's phones with e-wallet bulk send. At FNB, we're constantly innovating to help business owners at every stage of their journey.
The coronavirus outbreak has put everything at a standstill. We get reports every day of the extent of the economic damage this outbreak has had thus far. We also know of the various courses of action that most governments have taken to contain the virus before it claims any more lives. Most of us get these updates from the comfort of our own homes, surrounded by our family and friends. While the government of Botswana continues to put more effort towards stopping the possible spread of the virus, imposing liquor trading halts and closing all entertainment spots for some time, encouraging companies to make employees work from home, we are comforted by the fact that we are home. There are Botswana, however, in many parts of the world that are more affected than Botswana. There is anxiety surrounding when there would be no new cases, no more deaths, or when the situation would normalize, if it ever would. First Issues spoke to Rudirana George, who's a student in the United Kingdom, a teacher in Cambodia, Beulah Tsosa, Lindiwe Mokete, who's a student in Canada.
The situation with COVID-19 in Canada, I would say, is very unpredictable. Even though the government is working hard to try and contain the spread of the virus, we continue to see new cases every day. When all of this started, the situation escalated very quickly.
Right now, as we stand, there's around over 10,000 confirmed coronavirus cases in the UK and around 800 lives lost so far. This has been really a serious issue because we've seen restaurants, shops, and different types of industries affected. So it's pretty much brought a halt to people's lives.
We went from just a few cases to 1,000 cases in a matter of days, and we went from everyday normal life to a lockdown.
I would say the situation here concerning coronavirus is still normal. People are still going to work, shops are still open, markets are still open. Everybody is going on with their everyday lives.
Just like here in Botswana, these various governments have tightened the grip on measures on curbing the virus from spreading within their borders.
What is happening is that the government has closed all the schools, all on the land borders going into Vietnam and Thailand. The airport also, there's no flights coming in or out of the country at the moment.
The government, like a few days back, decided to introduce self-isolation and restricting unnecessary movement of people across different cities or just moving around. So yeah, I've been just being at home for like the past 3 weeks itself. That's pretty much just to prevent myself from contracting the disease.
Currently, Canada has closed its borders, and the government has mandated that all non-essential businesses and services are closed down, and continues to encourage the public to practice social distancing and to avoid all non-essential travel. Just continue to wash your hands and stay at home. And only leave if you really have to.
The government is also educating people on measures to take to prevent the spread of the virus, to wear masks, to use sanitizers, wash their hands all the time. And the government has also said it will provide free medical treatment for all locals and foreigners in the country.
We've seen also people also coming up to volunteer to help out whenever they can, donating a few staffs. Also, like in terms of like health workers or anybody that's in the front line, like your police officers, they're always given priorities at stores. Like they just go in and buy whatever they need so that they could go back into the battle.
Theirs has been a longing for home at a time when the safety of their families depends heavily on them staying away.
One of the most difficult things about the situation, of course, is not being with family. Even though Canada has better control of the situation compared to other countries like Spain and Italy.
Yeah, I'm always like a bit concerned about back home. I always try to think about like my family, my relatives.
I miss home at the moment. Yes, I miss my family, but I feel like the situation here is not as bad as what I've seen happening in the other countries.
It's always tough, like being away from home and knowing that you can't really go back because we also have like that travel ban put in place. So you just definitely just gotta stay praying and just hope your family, your relatives, wherever they are, they're just taking care of themselves.
At the end of the day, family is not there. You don't know what the next call from home means. I know, there's no cases in Botswana currently, but that could easily change. And you never know if that's going to affect your family. They don't know if I'll be affected, even though there's all these measures put in place. You really don't know.
When running a business means
Where did I put that receipt?
we can help you with instant accounting, free software that does your bookkeeping for you. When running a business means
Wait, what do you mean the container hasn't arrived?
we help protect your business from risk with Mohwebi Insurance. And when it means
How do we pay our staff that don't have bank accounts?
we help you make multiple payments directly to people's phones with e-wallet bulk send. At FNB, we're constantly innovating to help business owners at every stage of their journey.
Welcome to First Issues. Over the past few episodes, we have offered insight into basic economics by affording an economist the opportunity to explain a few concepts in the field. So far, we have covered the cost of living, the rate of inflation, and the gross domestic product. Tonight, we once again engage the expertise of researcher in economics Khomolemo Basele on another economics term, per capita income. At this year's National Budget Speech Deliberation, the Minister of Finance and Economic Development, Dr. Thapelo Mateka, said Botswana's per capita income sits at around $8,000, but he envisions for it to exceed $12,000 by 2036. This would move Botswana's income status from middle to high income status. In our discussion, we wish to understand what this means by first explaining what per capita income is.
Per capita income basically is our nation's GDP divided by our total population. And the intention with this measure is to give average earnings within Botswana across or based on the size of our population as well as the quantities we produce across our different industries, right from agriculture right through to our service industries.
I need for you to elaborate further on that. When you're saying the average earnings per individual, looking at your gross domestic product, does it mean each individual is getting like a portion of that? Are they given that money? I mean, understand we're talking to a layman here.
Yeah. So per capita income is a bit of a crude measure. The intention is to give some indication of where average earnings should be based on the different products we produce across our industries. But like you say, it doesn't necessarily translate into the majority of the population actually earning those figures. Because even as a nation, our production or our output is concentrated among certain industries. So you find people working, for example, within mining, a major industry in our case, but the issue with mining is that it's only able to employ a certain number of people. So there'll be only a certain number of people that earn above, for example, this per capita income that we're talking about. But in then other areas such as your trade services are traditionally known to be lower paying industries. So you find that most of our population is actually concentrated around the lower paying type industries, and therefore the per capita income that we speak of, which is inflated by production such as mining, does not necessarily translate to the rest of the population.
What determines if a country is low, middle, or high income?
There are different thresholds used to classify countries as being low, middle, upper middle income, as well as high income, like you mentioned. So depending on where that nation's per capita income falls, then they are then classified according to this classification. As Botswana, we are classified as an upper middle income economy with a per capita income level of around $8,000. But this does not necessarily mean that every single individual in Botswana is expected to be earning around that figure, which is not the case, as we've seen according to different cost of living statistics that we have, as well as the incidence of poverty within our borders.
In his inaugural budget speech, the Minister of Finance and Economic Development, Dr. Thapelo Matseka, said he envisions for this country to move from middle income to high income. What efforts would go into seeing that become a reality in the 2036 that he envisions this to happen?
Well, over the next 16 years, I think the minister also highlighted a few key areas that they wish to focus on to try and get us there. And these were promotion of export-led growth, building human capital, more efficient spending by government and financing, as well as the provision of various infrastructure that we need in line with our national development plan. Now, the intention with this is that, or these four key areas are expected to create an environment where we have businesses cropping up, exporting goods beyond our borders according to the different trade pacts that we're a part of. And as this happens, it will create more opportunities for Botswana to find employment, addressing the significant unemployment challenge that we have, as well as lead to increases in real wage growth. Now, as that happens, we'll see Botswana being able to earn more through various opportunities that will be made available to them as these key priorities are given attention over the next 16 years. And as that happens, the hope is that Botswana will be able to push its per capita income level beyond the $8,000 mark that we are currently at.
This program was brought to you by First National Bank of Botswana.
FNB, how can we help you?